Hey everybody, welcome back to the NJRI channel. I'm Dr. Bowen. I'm a board certified physiatrist here at New Jersey Regenerative Institute, or NJRI. Today we're tackling a topic that's crucial for athletes and active individuals, ACL and MCL tears. Whether you're a seasoned pro or just starting your fitness journey, understanding injuries is a key to both prevention and recovery. So let's break it down. First up, let's talk about what these tears actually are. The knee is a complex joint supported by ligaments to help stabilize it. The critical ligaments are the anterior and posterior cruciate ligaments, or ACL and PCL, and the medial and lateral collateral ligaments, or the MCL and LCL. The ACL and PCL prevent movement within the knee from the front to the back, while the collaterals are from side to side restrictions. The ACL and MCL are the more commonly injured ligaments in the knee. The ACL ligament is located in the center of your knee, and it helps control rotational movements as well as preventing that tibia, or lower leg shin bone, from sliding too far forward relative to the femur or the thigh bone. A tear here can be devastating to your stability and function. On the inside of the knee, the MCL runs along the inner part of that joint. It's responsible for stabilizing the knee by resisting forces that push it sideways. A tear of the MCL can cause pain on the inside of the knee and have a feeling of instability. Now, let's dive into why these tears occur. ACL tears often occur during activities that involve sudden stops, changes in direction, or awkward landings. So think about sports such as soccer, basketball, or skiing. So it's usually caused by the sudden pivoting or twisting direction, and that can put immense stress across the ACL inside that joint. You can also have a direct impact that's a forceful collision on the side of the knee, such as a tackle in football that can lead to an ACL tear, or landing awkwardly, such as when you have your knee in the wrong position and that creates some stress. This also can happen a lot with girls that are adolescents. They have a knock knee, sort of altered biomechanics, and when they land, their knees move together and that causes some more stress. On the other hand, MCL tears are often caused by direct blow to the outside of that knee, and that can cause not only an ACL tear, but also an MCL tear. And this is a collision on the outside of the knee, such as football or even a sliding kind of tackle in soccer. And this sideways push from the outside to the inside stresses that inside ligament, that MCL. And then MCL is trying to resist that force, but when it's overcome, that load just stretches it or tears it. Also, you can have some overexertion. So if you bend that knee too much and then you do it in the wrong awkward position, that MCL goes beyond its limits, stretching the inside of that knee, and then that ligament gives way. Also, a twisting injury, usually with the foot planted, can strain that inside ligament, that MCL. Now, once you've got a diagnosis, the next step is going to be treatment, right? So the approach may vary, and that always depends on the severity of the tear. So for complete tear of the ACL, surgery is often recommended to reconstruct that ligament. But it's not always necessary, despite the current hype and the frequency at which these tear repairs are happening. So there's a rule of thirds. First of all, everybody should really have a trial of physical therapy to see how they're doing. And about a third of people can compensate with therapy by retraining their muscles that oppose that translational force of that knee and that feeling of instability, and it's not happening. So they feel good. Another third can avoid surgery if they want an activity modification, and sometimes that's an option for people, sometimes they really don't want to do that. However, a third of people unfortunately continue to have shifting in that knee, it gives way only with little stress, and it feels just not comfortable, and they don't really have certainty in it. So if this happens, usually surgery is an indication. And recommendations are generally to wait about 6 weeks after you had your initial injury. Why? Because you want to reduce some of that bleeding that occurs within the joint, because that bleeding can increase the risk of what's called arthrofibrosis, or scarring inside the joint, and a lack of motion. Again, when you have that surgery, it's a big deal, so post-surgical rehab is pretty rigorous, and it's crucial for regaining the strength, motion, and your functional tasks, and potentially getting back to sport. Physical therapy usually focuses on rebuilding that muscle strength and stability. If an ACL injury is partial, we can place some concentrated bone marrow that you have in your own body in the ACL tear under x-ray guidance in the office, and something is pretty different and not really typically known. So that's unique to us, and that was invented by Dr. Centeno of Regenix. So at least that's an option you might not have known about. So shifting gears a little bit, treatment for the MCL, or that ligament on the inside of the joint, usually depends on the grade, right? So if you have a grade 1 or 2, so that's sort of mild to moderate, can be managed with the classic RICE protocol, right? That's rest, ice, compression, and elevation. as well as some physical therapy. So we may also recommend a hinged knee brace that can help protect that ligament from overload because it's already had a little injury, and hopefully help speed that recovery. Grade 3 tears, which are really that discontinuous part of the tear, are much more severe, but even with that, they a lot of times heal without any surgery at all. But for grade 3 tear, we usually advocate for initial non-surgical treatment, and unless you feel really significant instability, you can probably get away with just conservative care. But if other structures are involved, that's when you really notice more symptoms and more problems, and so that evaluation can go further to see if there's something else besides just an isolated MCL tear. So if you come to the office, what would we do? Well, first diagnose that MCL tear, then talk about conservative treatment, bracing, and maybe PRP. Prevention is always better than even the best treatment. So to reduce the risk of these injuries, there are things we should do, such as warm up properly, especially before engaging in any significant physical activity or your sport. Strengthening the muscles around that joint can also help provide support and help reduce some of that translational force that ultimately gets held up by the ligament, and if it's too much, tears. Flexibility or motion, also very important, and make sure that it's balanced from side to side and in front to back of the joint and joint to joint. Also, practicing your technique, such as running, jumping, tackling, landing, is really important. The most important thing is that technique, which translates into appropriate biomechanics, because what you're practicing becomes permanent, and that becomes your activity. Also, wear proper gear. Good footwear or protective braces might be beneficial depending on your sport. And there you have it, a comprehensive look at ACL and MCL tears. Understanding these injuries, their causes, how to treat and prevent them can keep you in the game and on your feet. If you found this video helpful, make sure you hit that like button and subscribe for more knee health videos. It doesn't cost you anything, but it really helps us and we really appreciate it. Also, people have told me that some of the videos they've missed previously, so make sure you hit that bell notification so you're notified when we drop content. If you have any questions or personal experiences to share, please drop a comment below, and thanks for watching. We'll see you next time.